With no further ado, I'm going to turn it over to Ray Bond, who's the Executive Director of Chattanooga-Hamilton County Medical Society Project Access, and Jennifer Flanagan, our President and CEO of Salvus Center.
Great. Thanks, everybody, for coming and sharing a few minutes of your day with us as we talk about one of the most exciting things we do, advocacy for public policy. It's really important. And we want to talk today just briefly to fill you in on our prospects for our fiscal 2021 to 22 funding and how you all can help us in that effort. And Jennifer and I are going to go back and forth a little bit. And we have a few slides with a little bit of information, but we're so glad you're here today.
Yes, thank you so much for being with us.
So this year, the policy committee and then the board of directors talked about a variety of initiatives this year. In some positions, while we don't actively have the resources to lobby them, we like to have positions if people ask us questions about where we stand on certain things. So our priority issues this year really are to fully fund the healthcare initiatives in Governor Lee's budget for fiscal 2022. And to support budget amendments that can bring the safety net funding hopefully up to $32 million. We're also hoping for a permanent extension of safety net and Medicaid COVID-19 telehealth flexibility and options. And we're also looking to renew the telehealth parity law. But for the purposes of most of our member clinics, the key priority is going to be fully funding the safety net. That is the program, the magic that makes everything else possible.
Mm-hmm.
So the the information that you're going to be receiving, and over the course of this meeting, Sarah is going to be putting several links and resources in the chat. So be on the lookout for that. Tennessee Charitable Care Network really represents community and faith-based health centers, project access, and dental programs. The safety net funding goes also to federally qualified health centers, which are members of the Tennessee Primary Care Association. And but the primary care plus dollars are divided between those two different categories of clinics, including dental and primary care programs. So when you're talking to legislators about the need for supplemental funding, we need to look at two things. One, it's important to let them know the reach of the Tennessee Charitable Care Network, but at the same time, we want to talk about the total reach of the safety net, because that gives legislators, first of all, a better chance that there's going to be a program that will directly impact their physician, their patient, their constituents. But it also helps them have a broader picture of just the extraordinary good that we do. So one of the pieces of data that you're going to see on page 1 of our fact sheet is going to be information about the safety net program as a whole, not just the Tennessee Charitable Care portion, which is considerable. So that will be some of the data you'll get in your fact sheet. A tiny bit about the funding history. This slide just goes back to 2017, but as most of you will know, there are a few new people on the call, but funding's gone up and down over the years. In 2020, we were able to get a significant increase in funding to $19.9 million for the safety net that serves both the FQHC portion and the faith-based and charitable clinics. Last year, between a combination of recurring appropriations, last year Governor Lee has expanded the recurring appropriations, and recurring appropriation just means that that's sort of what we can expect to be in the budget. It recurs every year unless a specific action is taken to delete it from the budget. And then we had a very nice supplemental appropriation that was approved last year as well by the legislature. This year, the health department has requested $20 million as recurring budget for safety net. Governor Lee's budget proposal adds 2 million additional. So that means there'll be a total of $22 million in recurring funding. Our goal is always to try to move the non-recurring funding, which we have to fight for every year, into the recurring pot. And we've had some success in doing that over the last 3 years. So this year, we have legislators who are requesting $10 million in additional funding that will be non-recurring funding. So does anybody have any questions about that? The state budget process is kind of a mystery, I think, to many people. So, okay, if no questions, we'll continue on. But that gives you just kind of a look at where we've been in the past. In the last couple of years, the state has revised the budget process. So all of the safety net grant funds in primary care plus bucket are absolutely expended each year. So we don't have any carryover funds. So this budget amounts what we will actually have to work with within the state.
And,
Go ahead.
I was just wanted to add that I think, we should all just really thank the leadership. I think it was really specifically Dr. Morgan's leadership, Morgan McDonald's leadership, to help redesign that in a way that took a lot of the tension. Of course, having a bigger pie helps a lot, but the way it's been allocated puts people in a together category as opposed to this versus that. And then they've put project access in its own category. All those things really are helpful to our members in terms of just feeling well and fairly treated. So thank you, TDH.
Yeah, Dr. McDonald's been just really terrific.
Incredible.
This is the Department of Health map. And so when you look at this, this kind of reinforces why we want to be sure legislators understand the broad reach of this program. So this will be on your fact sheet that you'll be sending to your legislators as we outline in a little bit. But it does show the wonderful reach, and we are working actively to try to expand programming over to the counties that are currently underserved. Project Access initiatives are working on a regionalization strategy right now that will also expand our reach. So Jennifer, do you want to
of course.
chime in for a minute?
Absolutely. Thank you so much. And again, to reinforce what Ray said, thank you so much for joining us today. The community and faith-based programs, as Ray was saying, are a large portion of the safety net distribution of funding. And so one of the strongest supports that we have for evidence-based funding, which we give this data to our legislators as a tool to be our advocates, are the patient encounters by type, and our total patient account, as you can see, is 70,415. However, our encounters are 292,650. So what that can show for us is that we are creating medical plans of care, dental plans of care for our patients that do go to and speak to primary care, which is what we're looking at. When you look at Project Access, which is an amazing program, at the number of patients and then the encounters that are included, that's getting these patients access to medical care. Dental, as we know, is a very significant piece of our physical health, our medical health as well. Critically important. And then the medical piece comes along as well with, you can see that for dental and medical, the ratio is proportional, but Project Access really gets that reach out there across for various encounters by making those connections. When we look at, and you look at the graphs, you can see it's right here of the locations, and we can go to the next one. If you look at the graph and you see the locations, this right here, right now, TCCN has 51 members in 57 locations across 30 counties of Tennessee. And just reading, as you can see here, we're also serving patients residing in neighboring counties. For instance, in Sumner County, I'll use that as an example, our criteria is the working uninsured who live or work in Sumner County. Therefore, if you work in Sumner but live in Macon, we can treat you, and when you have no other option. So for a service of 64 counties, when you're talking with your legislature, members who represent your districts, your patients who are their constituents, the more data you can show them as to the number of people impacted in your particular area, again, their representative area, that strengthens their ability to show that the evidence supports sustaining our safety net funding. And as Ray was sharing, we have had great support from the majority leader in the House, William Lamberth, on Finance, Ways and Means. He is, and Johnny Garrett, both, Representative Garrett, both brought that forward. And Senator Hale is in support. We do have 2 other senators who are bringing this bill forward for us. And it just is, we're trying to show that this is when it says member locations and services by region, these 3 regions make up our state and our citizens, our communities, really backbone. I'd like to take at this point too, to say that this is also an economic factor, because most of our patients may be economically by demographics challenged, and if they don't work, they don't get paid. And if you don't get paid, you have things like rent and food, and you have things like schooling, right down the line, and of course, medical care. So it also, if that is the way your representative looks at it, that's a good way to think about it. But we want people to have quality care, and we want them to have to be treated with dignity, and we want them to feel that, as Ray was saying, and as Mary was saying, collectively we are coming together for our health. So please take a look at these members that in your regions, and encourage anyone who might be a member of TCCN but isn't, to go ahead and join us, because there is strength in numbers there. The Sycamore Institute is a wonderful source for independent data. And they've been a great help for us. And as you can see here, the Robert Wood Johnson Foundation, we all know, is a wonderful organization that works with us and a number of other folks. But you can see by the coloring chart where the best healthcare is available, or options, resources, and perhaps not the best, down to the 95. So if you overlay that with the map that we just looked at where we have availability, and then you overlay that as to where locations of different types of facilities, you can see that this network is definitely making an impact, but we do have a ways to go. Earlier, you would have seen that we were treating 48% of the uninsured, and so that leaves us 52% to reach, which we're actively hoping to do in our strategic plan in the coming years.
This is an example of the Sycamore Institute data that's available just for Hamilton County, and a similar piece is available for each of your counties. So when you're talking to legislators or sending letters or having them visit your clinic, this is really a great document to review specifically for your county, and make a copy for your legislators, because it helps demonstrate the need that all of our programs are helping meet, and the fact that there's still an incredible unmet need that could be addressed with increased funding. So that's just kind of an example of, for my county, the resource that's available for each of you from your different counties. Okay. So today, part of what we want to work on today, or talk about today, is just advocacy. This year specifically, advocacy for that $10 million in supplemental funding that we really want to and need to get. But advocacy is really any action that favors, recommends, argues for a cause, or supports or defends or pleads on behalf of others. So think of this when you're talking to your legislator. We're pleading on behalf of those we serve. TCCN is about supporting our programs as we try to serve those who don't often have any other resource for healthcare in their communities. And there's advocacy to try to influence or defeat laws, pass or defeat laws. 501c3 organizations, as nonprofits, we can lobby. It can't be a substantial part of what we do. But a lot of what we're doing is really educating legislators about the needs of the low-income uninsured populations that we serve. So that's just kind of a reminder in general about advocacy. So there are a lot of different Tools for advocacy. Researcher legislators know about some hot topics they might be interested in. There's been a little bit of discussion, and every year we kind of have a dance about whether or not we're going to expand TennCare. Generally, I would like to see it happen, but I still don't expect to see it happen in Tennessee. So our programs are getting extra funding because that's seen as a way to serve that population without doing something that's very politically difficult. Your pitch should last for less than 5 minutes. If you're meeting in person, sometimes legislators will have the time and ask leading questions, but you need to get your ask out early in the conversation, state the need, make your ask, and then see if they have any questions. I tell doctors when I'm taking them to Nashville to meet with legislators, just because you go fishing with the legislator, don't start that as a conversation, because you'll spend the whole visit talking about their last fishing expedition and never get to your ask. So being focused is important. During your visit, it's important to lay the foundation. See if they're familiar with your clinic or your program. If you have some compelling, heartfelt stories about the people that you serve, that's a great thing to share. And the legislators expect to have requests. They work for us. We've elected them. And so they're expecting you to have an ask. So don't be shy about doing that. And remember, we're not asking for money for just to support our programs. We're asking them to help us provide access to healthcare to low-income folks who don't have many other alternatives. When your legislator visits with you, gives you his time or attention, send them a thank you note. And it's also really helpful to invite them to your program for a visit. There's nothing quite like them actually seeing the way you operate and the resource that you provide to the community to really be heartfelt and compelling. And then if they ask you for some additional information, very important, be sure to follow up afterwards and provide that information. So basically, as we reach out to legislators, our ask is simple. We want them to support the supplemental appropriation amendment to increase funding for the Tennessee Safety Net Grant program. There are several amendments that have been introduced. Senator Richard Briggs, Republican of Knoxville, has introduced a $10 million supplemental appropriation amendment for the safety net. Senator Jack Johnson has introduced a $3 million supplemental request. And Speaker Lamberth has introduced requests of both $10 and $3 million. That gives us some options. With the $10 million one, they could negotiate down and say, well, we can give you $7 million or $5 million. And so it kind of gives us a little bit more room to work in terms of where we ultimately end up by having a couple of different ones. If one of these legislators is from your district, and kudos to Jennifer for her work securing Speaker Lamberth, that's a huge deal. It's really important to reach out to them, to thank them for their support, and to see how we can support them. Now, at this stage in the process, it's important for advocacy, it's important for us to be sure that our legislators know all about our programs. And my mouse is being funky here. But for the purposes, specifically the purposes of the safety net supplemental appropriation request, we need to really focus on the Finance Ways and Means Committee. And so it's important to look at these legislators. Now, later in the presentation and in the chat, we'll have a link to a tool that takes you to the General Assembly. When you're thinking about the legislators to contact, I think our inclination is to think about what legislator represents the area where your program is located. But I want you to think more broadly, because what you really need to do is think about where your patients live. And so legislators should have an interest in anything that's helpful to their constituents specifically. So look at all of the legislators in your county or in the region where you serve, and all of those deserve contact. So these are the members of the Senate Finance Ways and Means Committee and the House Finance Committee. And so that's kind of our starting point for focus. It's also a good idea and helpful. The House Health Committee and the Senate Health and Welfare Committee, it's also really great to reach out to those folks and let them know what your programs do, that we're making this request, because there will be dialogue between those entities as they work through the budget proposals.
And if you notice too, from the previous slide, that Farrell Hale, who's a committee officer on the Health and Welfare, is a member of the Finance Committee. And Bo Watson, who is an officer of the Finance Committee, is a member of the Health and Welfare Committee. That puts them in, it's not a nice cross-reference, and they're in different roles in both committees, so they can be our advocate more strongly on open advocate more strongly or one than the other. So it's definitely worth the investment in that relationship. And as Ray was saying, really map out where their overall reach within their legislative organization, because you never know, the more we have from different directions, the more support we get to really build that base or that safety net.
And we're kind of fortunate this year because Tennessee is going to be getting some significant federal funding, and the Tennessee budget has actually performed a lot better than expected. So in a year when there's a huge fiscal crisis in the state, requesting supplemental funds becomes very problematic. That said, I couldn't find the exact number, but I think last year there were more than 200 requests for supplemental funding. So this outreach is extremely important to be sure that some of that is directed to our programs. So in the chat, we're going to list copies of sort of two different letters, just samples. Mary drafted one. One is a adaptation of the letter I sent to my own legislators. And you can send these letters, you can send them by email or you can mail it. I did it kind of early, so I mailed it so they'd have all the nice pretty color copies. I included the TCCN fact sheet in that, and then I also included one specifically about Project Access programs statewide that we developed. If you've got a fact sheet with some heartwarming stories, hopefully, about the patients you serve, it's great to include that because that makes it local and real to him. So you're going to have these two samples in your materials. This letter, in this approach, it talks a little bit about, Governor Lee's support and the programs we were able to add this year because of the additional funding and helping us maintain this momentum. So that's a wonderful, well-written letter and a great approach. You can use what pieces and parts of either of these you like. This letter can be tailored. I've got kind of blue capital letters there to see things. And in this letter, my approach was to say, the department requested this, Governor Lee requested this. We had this much last year. Please support these specific amendments. And then I have a couple places in here. I included in my letter the list of the 7 or 8 programs in our region that get funding. Because again, that helps them understand I'm not just asking for money for my program. I'm being very charitable and asking for support for all the programs that serve their constituents. And then you can put details about your local programs, contact information. So both of these letters are in the chat and are available to you if it's easier for you to start from some rough drafts. Just two different approaches. Are there any questions about that? Either of those or where we are so far? Okay. And Jennifer.
Hello. So in terms of contacting your legislators that represent your patients' county residences, and in good, for instance, as Ray is saying, it expands to talk about where your patients actually live because they may not live in your district, but you serve them in your district. So that just, again, getting to all of those legislators. But I would say that it's very important to include them, and there are ways you can include and inform without it being advocacy. So as you can see here, Partners for Healing locations in Coffee County, but the patients residing in Moore and Franklin counties also are served by the Partners for Healing in Coffee County. Therefore, you have multiple legislators you can expand to. I would say if you have a newsletter, just include it to their offices. You send those to patients, you send that's awareness and education. That's not necessarily advocacy. It gives them the idea that Ray was saying, these are all the things you're doing in the outreach that you're giving throughout their constituents with also your patients. It's important to develop, I would say the word is relationship. The relationships are key with your legislators, that your patients are who are served by who serve your patients. Also the support staff, the person who handles the schedule for your legislator is someone you want to have a strong and respectful relationship to. And also noting that just as there were over 200 amendments put forth, those amendments, those phone calls, those additional touches all go through their administrative staff. And if you have that strong relationship, respect who they are, respect the strain they're under, but also the reach that they have, you'll increase your opportunity to get a face-to-face meeting, even if it's just for a few moments. In your follow-up, in your emails, in your notes, always include the assistant, the supporting administrative person to your legislature. Copy them on those emails because they are the ones who are going to handle the logistics of this information getting to your legislator. Invite them to your events, invite them to your outreach. The more warm, if you plan a warm contact once a month to say, you know, these just FYI, these are workshops we're doing for our patients. FYI, we were just awarded by Publix volunteer projects for our county to show the incorporation that your organization has through other members of your county and your districts that are representative support. And I would like to emphasize also a point that Ray made, which is, and by the way, Ray is our guru for our advocacy, guys. What she's doing with the state and various committees, you know, Mary leading our organization, Sarah pulling things together as well as a director, but the relationships that Ray has developed across the years and navigating the systems have been invaluable. And that's where we get to really understanding the mapping of the people that you know. Because if you don't know your legislature, I imagine one of your donors, one of your Rotary colleagues, one of your Lions Club colleagues, Women for Business colleagues, chamber colleagues probably do and can give you that third-party introduction. So third-party introduction is important as well, if that lends validity and testimony. But when she said that the number of really they are working for us. So Ray, don't feel shy about asking. They aren't doing us a favor. We are working together to invest in our communities together. We elected them, or the community elected them to help promote and move that community forward. And we are a material piece of doing so. So it's a partnership, and it expects you to ask, and when you do ask, really have your data behind you and have your objective in front of you concisely so that you give them the tools to then express it outwardly to their colleagues.
Awesome. This is a resource Sarah put up. This is an app that you can download on your phone. It lets you monitor the activities at the state capitol and easily access information. You can also go to the Tennessee General Assembly website and look up members, committee members. You can see which committee your legislators serve on. But this is a really, the link's going to be in the chat box for this app. So I encourage each of you to get it. It is really a great resource. And then here are other resource examples also in the chat, and we're going to send this PowerPoint out after the meeting, and it'll have links in it. So here's an example of a couple of annual reports or impact statements. This kind of resource really helps put a human face on the folks that you're helping every single day. Governor Lee spoke at TCCN last year, and there's a link to his presentation. He's pretty popular at the moment, so it's probably helpful to listen to some of his remarks and glean some inspiration from that. So this is just these are just a couple more resources that are available. And that's the end of our slides. Are there any questions or topics you'd like us to cover, or Jennifer and Mary, what have we left out?
You haven't left anything out. I would underscore that in-person is always going to be best, but with the pandemic, nobody's expecting anybody to go in person. So, I think a letter, an email, if you have a relationship or want to establish one, trying to get a quick Zoom call is wonderful. Of course, TCCN and our public policy committee members will partner with you. If you would like to do that and want somebody with you to facilitate the conversation, the 5 minutes, we're here for you. So just underscoring those.
And I would say also, when you are reaching out, reaffirm our appreciation for the additional 2 million recurring. That's perceived as by the legislature and Governor Lee's actions as a real plus for us. So please thank them for that as we ask for that one-time amendment to help us sustain. So we're trying to sustain our level of care and as we go forward. And hopefully, as Ray was saying, that it will find its way into our base amount as we go forward.
Okay, so one last thing, timeline. The legislature is lurching through the session. They are holding committee meetings on every possible thing. So I would encourage everybody to try to make it a personal goal to get your letters and your contacts made. Hopefully by the end of next week, certainly in the next 10 days or so. If you need help with any of these things, Sarah has access to all the resources. Mary, Jennifer, and I are all readily available. If you want to practice your talking points, or if you need help editing, my staff will tell you I'm only much too good at editing other people's work. So however we can help you, we're here, and we appreciate all of your efforts. We definitely appreciate your membership, and we need each and every one of you to be involved in this whole process.
One last thing I'd like to add too, and beautifully stated, Ray, is bring in your board members, bring in your sponsors, bring in your other people who support you to reach out to these folks, because they too are constituents. And that helps to really emphasize and demonstrate that we are reaching out for the common good, not just our own organizations. And please look at the materials that Sarah's going to send you. They're the most updated versus copying from our wonderful presentation. Wait for Sarah's templates. They'll be the easiest to use that she's sending after the presentation.
Thank you.
It's Rhonda. I just want to say this was an extraordinary presentation. You guys went through a lot of work, but it is not falling on deaf ears. It's great. Thank you. Thank you. Thank you. One thing that I would like to try and do, some of the partners that I think have strong lobbying is Delta Dental and also the Tennessee Dental Association, for them to say something as well. Do we have anything sort of simple, easy draft that I could send both of those to reemphasize that you support these FQHCs, these faith-based clinics, lobby for us?
Yeah, that's a really great point. And I have contacted Delta Dental, and they are, Dr. Wenk is trying to get more money for the denture. So that's on our agenda, the denture program. I think it's really helpful just to send a note saying, I want to share, this fact sheet with you along with our policy agenda. I don't, and just underscore the part of how their partnership is really supporting the work that, all our members are doing. I don't think it has to be complicated to put it in a lot of people's hands, because the materials themselves are so full of information. And I think very attractive. Want to just give kudos to Sarah for her continued design mastery. She does beautiful work.
And fast. No, Rhonda, I think that's really brilliant. The other thing you can do, you can, for your legislators, it's not that difficult to do a little bit of a search and find out who contributes money, the larger contributions to legislators. And if you probably have somebody on one of your boards or who's close to your program that also has contributed money to legislators, that's getting a word put in from that kind of person is always really helpful. They like to remember, they like to dance with the person who brought them to the dance. So that can also be very helpful. Okay, any other questions or comments?
And all of the things that you've seen will be in an email that Sarah will share with you after.
That's right.
Thank you so much for being with us. And if questions come up, we're available.
Thanks, you guys, for all the information. It was great.
Good.
Thank you for your time.
Please help.
Have a great day, you all.